Hi, I'm Dr. Johann D'Souza. I'm a clinical psychologist and I specialize in anxiety and OCD. Today I want to talk to you about how to help your anxious child. Let's start with understanding what anxiety can look like. So, one thing to watch out for is behavioral signs like avoidance, avoiding social events, or avoiding going upstairs alone, or going into a dark room alone, or going to sleep alone. It could be avoiding going to school. Then we can also look at physiological symptoms, like for example, breathing changing, heart rate changing, complaining of headaches, stomach aches, nausea, even when there's no physical illness. Maybe their mind goes blank. Maybe they have racing thoughts or difficulty concentrating. Look at these signs of avoidance as symptoms of anxiety. Basically, anytime that someone stops doing something out of fear, they're developing a vicious cycle because they're reinforcing the fear. The more that we avoid doing things out of fear, the bigger the fear becomes in our mind. And then the next time, it's going to be even more fearful, which will lead us to avoid that thing even more. And the next time, it will be even more fearful. The good news is, just like anxiety can increase over time and often does if it's not dealt with, we can reverse the trend by intentionally facing our fears. If the person is afraid, but he leans into it, then the next time he's not going to be as afraid. And maybe you can apply that to your life with things that you were less comfortable with at first, but you became more comfortable with practice. Some people experience this with public speaking. At first it's very difficult, but if they have an opportunity to practice it willingly, it gets easier. Part of it being willing is important as well, because if the person is fighting against it, then even if they're doing it again and again, they may not get used to it. Now, if you notice anxiety in your child, what do you do as a parent? There's basically two things you can do. And this comes from a very effective research-supported strategy called Supportive Parenting for Anxious Childhood Emotions. It's research done at the Yale Child Study Center by Ellie Leibovitz, supported with research trials. I was involved in one of them at Baylor in Houston. I've used this treatment with parents, and it's probably the most effective treatment that I use. In just a few sessions, the parents see a difference in their child. The very interesting thing about this treatment is it involves working directly with the parents and often exclusively with the parents. Most of the time, I never even see the child, not even one time. Just by changing what the parents do, the child's anxiety goes away. Pretty cool. So what are the two things that the parents want to change? The first thing is eliminating accommodations. Accommodations are anything that the parent does to help their child avoid anxiety. For example, letting the child skip school because of anxiety. Doing things for the child, like for example, talking to the child's teacher to ask for homework or to ask for preparation for the test. Letting the child do things like co-sleep, sleeping with the parents, even when the child is 10, 12 years old. That's just feeding the anxiety. It's really understandable that parents would give these accommodations because no parent wants to see their child suffering. But you have to realize that by doing these accommodations now, you're just feeding your child's anxiety, making he or she weaker and more dependent on you and less independent, less confident, less resilience. True confidence comes from the inside when the child realizes he can do whatever he puts his mind to. But he can only experience that if that training wheel is taken away. At some point, those training wheels have to be taken away so the child can experience failure and success. So eliminating accommodations. You may want to make a kind of chart of all the accommodations throughout the day that you and your spouse do for your child. Recognize here that giving reassurance is also a form of accommodation. That's very common. Just something as simple as saying, hey, everything's going to be okay. Don't worry about that. You're going to be fine. Those are inadvertent ways of feeding the anxiety, providing that accommodation. And if you're dealing with an anxious child, the child's probably going to be seeking reassurance from you. So it's going to be difficult not to provide it. And then parents ask, well, what do I say? What do I tell my child if she's asking me for reassurance? This gets to the second part of the treatment. The first one was accommodations. The second is providing supportive statements. Supportive statements are technical. They has two parts to it. The first part is providing empathy. I see this is difficult for you. The second part is providing confidence. And I know you can get through this. When we put those together, I see this is difficult for you, and I know you can get through this. As two parts, both of those parts need to be there. Like peanut butter and jelly. You need to have both of those parts there. Where parents get this wrong is two things. One being over-permissive, over-accommodating, over-comforting. Oh, I'm so sorry you have to go through this. Let me do this for you. Hey, it's okay. I'm here to support you. You don't have to do that. I'll do it for you. All those ways of just giving in too much, being too accommodating, too permissive. Usually that's on the mom side. On the flip side of that is being over-demanding. Over-demanding sounds like you should be better than this, you should be stronger than this, your little sister can do this, why can't you do this? You need to grow up, you need to toughen up. All those things may be true, but children don't find that helpful to hear. And you probably wouldn't find that helpful to hear either. So that's usually how dad approaches the situation. And oftentimes what happens is each spouse sees the other spouse doing something they don't agree with, and so they get more extreme on their view. When the mom sees the dad being over-demanding, the mom responds by being even more accommodating. When the dad sees the mom being over-accommodating, the dad responds by being even more demanding. And neither of those are helpful. The child is not growing through that. So we're asking both spouses to meet in the middle. We're going to take the best from the empathic side by acknowledging the suffering the child is going through. I see this is difficult for you. I see you're suffering. I see this is tough for you. And at the same time, expressing our confidence in the child. And I know you can get through this. And I know you can overcome this. And I know you'll be okay. So what that sounds like in combination, again, is I see this is tough for you, and I know you can get through this. It sounds very simple, but it takes practice to make it automatic. So when your child asks for reassurance, or hesitates, or avoids doing something, first, you don't give any accommodation. Second, you throw out that supportive statement. I see this is tough for you, and I know you can get through it. The important thing is only giving that supportive statement once per incident. Because if we give it more than once for the same incident, then in itself it can turn into a type of reassurance. And also, we want our actions to speak louder than words. If we're truly confident that the child can get through it, then we want to express that in our actions by saying the supportive statement once and then stepping back and letting what happens happens. And the first time the child has to go through it on her own, yeah, it's going to be difficult, but she'll survive. And then she'll learn, hey, it is possible for me to do this. It was difficult, but it is possible for me to do this. And then the second time, she again maybe seeks a reassurance from her parents. Parents don't give it. They provide the supportive statement. She realizes there's no alternative. She does it. Hey, it worked again. Gets easier and easier over time. The great thing about kids is they learn quickly. They can really get through anxiety disorders very quickly, actually, just by the parents changing their behaviors. The way this treatment is laid out is in a few stages. The first stage is we explain what anxiety is, how it works. The second stage is providing the supportive statements and mapping out the accommodations. Once we have a good map of the accommodations, we get ready to make an announcement to the child about this new approach that we're taking. So far, all we've changed is we've provided supportive statements, which is great, but we haven't eliminated any accommodations yet. Once we start eliminating accommodations, the child is going to notice this is a change. So it's only fair to explain why we're changing things and that we're changing things. This also allows the parents to make a clean break with the past, so that the child isn't so confused as to why are my parents acting so differently all of a sudden. The way we make that clean break is through the announcement. The announcement is something written starting by expressing how you love and appreciate your child, then stating how you realize you haven't been helping your child and how you are going to change. It's really important to put the emphasis on you, the parent, changing, not the child. We don't want to make it seem like the child is in trouble or that the child has done something wrong. We can't control the child. We can only control ourselves. So you as parents change what you do because you realize it has an impact. Then you just end by saying, we love you. And this is what we're going to do different. From now on, we are not going to answer text messages when you're at school. From now on, we're not going to let you skip school. From now on, we're going to lock our bedroom door so that the 12-year-old child can't sleep in the middle of the night to the parents' room to sleep. You have control over locking your door. So that's the announcement. The child can accept it, the child can reject it. It doesn't really matter. The important thing is you've communicated the concept, and now you have a clear rationale for changing your behavior. And then step by step, you start eliminating accommodations. I would start with eliminating one that's easier, that you can get a quick win from, and you can notice some benefit from. So you and your wife agree on that, eliminate that accommodation, wait for a week, and then you can come back and pick another accommodation. And then you just knock them out one by one. Usually this is a pretty smooth process, only takes a few weeks. And remember, you're sprinkling in those supportive statements throughout. Sometimes if the anxiety has been developing for a while and is more severe, it may take a little bit longer. You may want to be involving outside supporters. The benefit of outside supporters could be a neighbor, could be a teacher, could be a coach, could be a grandparent, someone for the child to turn to when they're feeling overwhelmed. That way, the parent doesn't have to provide reassurance, and at the same time, the child feels like he's getting some support. Not always necessary, but sometimes it can be helpful. That's basically the treatment for anxious children, just by working with the parents. The beautiful thing about this treatment is it helps all of your children, even the ones that don't have anxiety, because you're going to build the habits of letting them do things for themselves, which is how children get more resilient and more confident and more responsible and more mature and grow into being adults. Because remember, you're not raising children, you're raising adults. Let them do things for themselves. So it helps your other children. It also helps the parents, because it can be overwhelming to be providing all kinds of accommodations to your anxious child. You're giving yourself more work than you need to. You don't need to be doing all those things for your child. Not only is it better for you, but it's better for your child to step back a little bit. So just giving the parents permission to step back. Some people wonder how this anxiety developed. In my experience and in the research, what we often see is anxious children come from anxious parents. Again, in my clinical experience, oftentimes, if there's an anxious child, the mother is also anxious. If that's the case, well, for one, this treatment can help the mother because it forces the mother to get comfortable with being uncomfortable. to be comfortable with seeing your child suffer, which is part of growth. All growth comes through suffering. So it's helpful for the mother to practice just seeing your child facing the anxiety and not swooping in and saving the child. But if the mother has an anxiety disorder herself, it could be good to consider seeking individual therapy for that. Individual cognitive behavior therapy for anxiety. It's probably the most research-supported treatment in all of mental health. We know how to treat anxiety. It's extremely effective. There are many specialists out there. I would look for someone who specializes in cognitive behavior therapy or acceptance and commitment therapy for anxiety disorders. Mom has such an important role in the family. If we can get mom having a healthier relationship with her emotions, being able to cope with her emotions positively, that's going to have such an impact on the whole family. So if you need that help, don't hesitate to look for it, because your well-being is important. It's great talking with you. If you have any questions, feel free to reach out to me. I'm Dr. Johann D'Souza. I'm a clinical psychologist specializing in anxiety and obsessive compulsive disorder, specifically providing modern psychology with traditional family values. That's dignity of human life, created male and female, and the beauty of chaste love. Thanks for tuning in.